My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank with My Doctor Said What? This is episode 30. Thanks so much for my 60,000 plus listeners and my viewers on my YouTube podcast. 15 minutes every Thursday, of which you can stream anytime you'd like. Also, I'd like to say thank you to those that have viewed and sent comments on the Facebook, Instagram, and TikTok videos, little short ones, the 3 minutes. Trying to make you feel better for this great Thanksgiving coming up. A lot to be thankful for if you're not sick or in pain. And if you are, I hope you feel better soon. And I want to talk about that a little bit today. Pain management, pain, what it does to you. Pain is something none of us like. The quicker it's gone, the better we feel. I bruise like a grape, so I really hate pain. So I like to get it over with as soon as possible, if possible. So before that, a couple things in the medical news and facts. If you have benign prostate hyperplasia, enlarged prostate, and if you're a man over 45, you probably have that, or you're beginning to have that. There's all kind of treatments to shrink the prostate that are fairly invasive and a lot of side effects that are unwanted. So anytime we have a new therapy or treatment for that, it's good news. And then we have some drug therapies that are great, but now there's something called PAE, and look it up. PAE is where they go in a small 1/4-inch incision in your wrist or in your groin, preferably, and they inject some pellets into the arteries going into the prostate, and they effectively stop the blood flow to the prostate in certain areas, and that causes the tissue that causes a problem that pushes on the urethra and causes the nighttime urges to urinate and the urgency, the frequency, the dribbling, all those things, and it kills that tissue inside the capsule and allows that urethra to expand again, and alleviates those problems without any unwanted side effects. Over 90% don't have any sexual side effects, no retrograde ejaculation, no incontinence, none of the things that you might have with some of the other deals. And it's you're put in twilight sleep, so you're not really put out. So for those at higher risk for anesthesia, it's a great procedure. So look that up. I always encourage you to go to WebMD or Harvard Medical or one of the better websites and look those things up. You're your best patient advocate. You need to be the one for your loved ones or for yourself or your friends to look things up and not go to Facebook or Dr. Google or some of these things to look at new technologies or medical treatments or medical diagnosis. Make sure you go to reputable sites, do your research on yourself, and ask intelligent questions of your healthcare provider. With that said, talking about pain. Pain is interesting. The brain doesn't feel pain, but the brain receives the signals that you feel pain from. You have a network of nerves throughout your body, and the role of those nerves, one of the roles is to perceive pain so that you remove your hand or foot or whatever's having pain from that which is causing the pain, or to give attention to something. You could have something as simple as an allergy, which causes pain in your head because your sinuses begin to swell, and that tells you something's wrong. It's your body's early defense system, warning system. So pain is a good thing in some ways, but when pain becomes chronic or consistent, it's very difficult because it affects you psychologically, it affects you emotionally, it affects your well-being. It affects your ability to eat, sleep, and function. So we like to manage pain. How do you manage pain? Well, there's three ways we manage pain. One is we have to manage it psychologically. It is a mindset, and it's interesting. Studies show that people that look at pain different ways. Some people are just whiners, and I don't mean to minimize your pain, but some people are a little overly sensitive. Then you've got people that want to just tough through it, which is, you got to be careful, because that's how you can make a small injury into a big injury. Athletes are good about that. Now, I'm not talking about professional athletes. I'm talking about your weekend warriors that say, I'll just go through this. A good example is my wife is a endurance athlete, a runner, and former Ironman, and a lot of times they'll push through things, which you can do temporarily, but over time, you get wear and tear on your knees and your back and that, and so nerves tend to have issues. Now, if you're an orthopedic surgeon, one of the problems in America is a lot of back pain. Backs and knees are probably the worst complaints that you would hear. And what you find is those, as you grind away on tissue and have tendon issues or ligament issues where the nerve becomes pressed against by muscle or tendons, and that, you end up having chronic pain, and that pain can require some moderate management to surgery, which is more extreme, obviously. But we've got to deal with it psychologically. Then the next step is physical therapy. We use heat and ice, and if you look up the rice deal, you have to rest. Then you've got to have ice, cold. Then you go to hot, and then you go to movement, exercise. So you want to make sure that you appropriately deal with immediate pain that you get from some injury. If you cut your finger or whatever, that's your body telling you, oh, this needs attention. Stop the bleeding. Get to your healthcare provider. See if you need stitches. But in the meantime, you got to be calm, because pain raises your blood pressure. It causes your heart to palpitate or speed up. It causes you, in really bad cases, to go into shock. So you have to be careful. Pain, you have to understand that it should be temporary, that in most cases, and that you need to relax, calm yourself so that you don't make those nerves fire worse and cause hyperventilation and shock and all these really bad things. And just say, hey, I understand it's my body telling me I need to do something about them. Your healthcare provider will, if you have pain, that can be helped significantly by physical therapy, hydrotherapy, stretching, those things. Then they'll prescribe that. And one of the ways you can really prevent pain is through stretching. That's why I used to laugh at Pilates and yoga, but those are things which stretch your muscles and cause you to really get range of motion, which many times can prevent that compression of your nerve by your muscle tissue and by the effects of aging that cause us to have spine issues, and that, especially if we have excess weight. Believe it or not, your diet can affect your reception of pain. The better shape you're in physically, the better your nerves heal, and the better that they transmit pain in a way that you can deal with, instead of just being really sharp, untenable, unbearable pain. So all those things, exercise, diet, good sleep, can help you cope with pain. Now, when we get into chronic pain, for those that have chronic issues such as arthritis, it gets difficult or whatever, if you can't fix the underlying problem with surgery or whatever, and you have to deal with chronic pain, and that is a really tough situation, but obviously some elderly people and some younger people have to deal with it. If you have chronic pain that's unresolved and not treated, it'll actually shrink the gray matter of the brain. And part of that, we believe, is a response to the body that it's so unpleasant and so difficult and so hard on the body, chronic pain, that we think that that's one of the body's responses to that. The gray matter starts to shrink, which unfortunately affects your cognitive processing, your how you think, see things, read things, your speech, your ability to have memories and memorize things. All those things, put words together, sentences together. So chronic pain can be a real issue, and you'll see that if you look at geriatric patients. So you want to look at that. Those that are called super agers, those over 90, they're really good at managing pain, and they've mentally, physically stretching, exercising, eating right, sleeping right, as well as any pain management they take, they try to take in a way that their healthcare provider says is best for them. Things like aspirin or NSAIDs, Tylenol, Aleve, ibuprofen, Motrin, all those things can be useful. You got to be careful and talk to your healthcare provider or your pharmacist. You don't want to take those over long term because you can have some effects on your kidneys and liver, etc. And you certainly don't want to go over the doses that are on the labels or that your healthcare provider tells you. Just because a medication's over the counter doesn't mean you can abuse it. And also, when we talk about drug abuse, it's not just illicit drugs that people abuse. You can abuse prescription drugs by taking someone else's, taking it improperly, or taking doses that are too high or too low. Those are all abuse. And then you don't get the benefit of the drug, and you get the side effects without the benefits. So you don't want to do that. But managing pain can drive people to do a lot of things. So I'd ask you to really talk to your healthcare provider, explain the level of pain. They'll give you a scale of 1 to 10, and they'll explain what that is. 0 is what I feel today. I don't feel any pain. When I get up in the morning, I'm probably a 3 because my hips hurt and shoulder hurts and all the things that just by being older. But as I move around and the joints become loosened up, warmed up, then it's great. But you get people that are constantly in a state of 5 or above, and it can affect your quality of life. So see your healthcare provider. There's many things you can do. People instantly think of opioids. Opioids were made specifically for chronic, intense pain or end-of-life pain. And abusing them causes a lot more pain in a lot of ways, psychologically, physically, in many different ways. So you don't want to abuse drugs in any way, shape, or form, prescription or illicit drugs. You want to make sure over-counter, you take them as prescribed, and you don't take them past the duration that the directions and contraindications tell you on the label. Read the label. That's why the label's there. But dealing with pain for most people should be something that is a temporary situation or a situation that can be managed very well. So anti-inflammatories such as NSAIDs, they really do reduce the inflammation. Icing something when it's first injured as muscles or tendons or ligaments, as your healthcare provider advises, will reduce the swelling, reduce the pain. Then heat later or hydrotherapy with hot baths, warm showers can make a huge difference. It gets the blood flow in there, gets it healing, and that makes a big difference. Age-related diseases such as osteoarthritis, you'll have to manage it with some different medications and that will help you not feel that pain. The brain won't process it, and you won't have to feel it, so you don't have to deal with the psychological issues or the increased physical issues that kind of cascade in a downward spiral. So you want to manage pain, you want to get on it early. And as everything we talk about, a good healthy diet, good sleep, and good exercise will make a much nicer life with much less pain in most instances. Now, obviously, if you have a chronic disease or a disease of serious nature, you have some types of cancer and heart disease, you can have pain, both psychological and physical, that need to be dealt with on a different level, and you need to see your healthcare provider about those. But almost all pain we can deal with these days medically and psychologically. So with that, I'd say have a great Thanksgiving, and live a pain-free life, or at least a well-managed pain-free life. And see you next time. Have a great day. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.